Hey guys, I'm David DeMuzio.
And I'm Steve Cook.
Welcome to Hair Loss Hope, and today we are going to talk about 3 mistakes to avoid on the hairline when getting a hair transplant. So the first mistake to avoid is screwing up the temporal peaks, which are probably the most difficult part of a hair transplant to do artistically. So Steve, how can those be screwed up, and what should a patient be looking out for?
I think the first thing, David, to look for is a doctor that has really good experience with temporal peaks. Just flat out ask them. Ask them to show you photos of profiles from the side. If you look at David, when he turns his head to the side, he's got phenomenal temporal peaks. That's one procedure. And I think that's really all he needs. Now, you might say, well, what's the big deal? You put a few hairs in the temporal peaks. It is a big deal. Excuse me, it is a big deal. The big deal is that it's not easy to do. So I like to kind of bundle temporal peaks in with doctors that do really good facial hair restoration. It's just not that easy. The angles are harder to do. Making it go a certain direction is harder to achieve. And everything has to be done under microscopes. You have to have really good staff to place the tissue properly. And the entire part of that procedure is a lot more detailed than you would think.
There are a couple things to keep in mind when looking into doing temporal peaks. One of those is that they're not too symmetrical, meaning they're exactly the same on each side. Now, no one's body is symmetrical, and that's something we're going to talk about a little bit later in the video for other parts of the hairline. But with the temporal peaks, you want to make sure that each one is a little bit different. So it will actually look more natural if they're not exactly the same. Another thing to keep in mind is how low you put your hairline. So if your hairline is going to be more aggressive, like more youthful looking, like mine is a little bit lower, then you're actually more likely to need more temporal peak work done. So that's something to definitely consider, and your doctor needs to consider depending on how many grafts you have and how many procedures you're planning on getting done and all of these things. Another thing is if your hairline is a little bit higher like Steve's, depending on how much loss you have, you might not need as much temporal peak work done, though Steve as well has had some temporal peak work done. Again, last thing when it comes to temporal peaks is the quality of your donor hair is going to make it more or less difficult for those temporal peaks to look natural. And that's something that you're just going to have to accept to a certain degree, is that the temporal peaks are the finest, wispiest part generally of our hair or hairline sort of area. And so I have thick donor hair. So if the donor hair is coming from, let's say in a strip procedure, a FUT procedure, is coming all from this part of the donor area and from the strongest area, well, that's generally good, but could actually be in some kind of way a bad thing actually, and something I need to realize. If those hairs are going to go into my temporal peaks, they're not going to be really fine and wispy looking. So at the same time, Steve has a little bit of an advantage because in this way, he actually doesn't have as strong, thick donor hair and is a little bit more fine and wispy. And so the advantage that he gets with that actually is that when I look at Steve's temporal peaks here, this is like completely natural. It looks perfect. So even as me, as someone that's seen many hair transplants and is very knowledgeable and instantly can sort of pick out transplants way more than your average person would be able to, there is no way that I would be able to tell that Steve has had his temporal peaks worked on. I could sit here and I go, no way. Like it's a 100% natural. On the other hand, if I looked at myself and my temporal peaks, being a trained eye like I have, I would be able to tell that my temporal peaks have been worked on. Now, our temporal peaks were done by the same surgeon, so it doesn't come down to how good that surgeon is at doing temporal peaks. It really comes down to the actual donor hair that's been used to do that. So your average person or even most trained people, I don't think would be able to know that I had temporal peak work done. But if you're really, really good, then you would definitely be able to tell. So yeah, it's just sort of a naturalness and give and take. So the number 2 mistake to avoid when getting your hairline worked on is too much symmetry. So Steve, what do we have to say about this?
Yeah, you would think because you've gone bald or you really hate your hairline that you're going to spend all kinds of money. These things are not cheap, as we always talk about. And you're looking at like Hollywood celebrities. I like to use Zac Efron as an example, who's got an amazingly thick, I don't want to say unnatural because that's his real head of hair, but he's got a head of hair that no hair transplant doctor in the history of the world can duplicate. So if one of those hair transplant doctors tried to duplicate Zac Efron's hair, it's gonna look funny and weird. The two things in a hair transplant that we all want is we all want them to grow and we all want them not to look funny or weird. So when you go into your transplant and you've chosen the right doctor, the right clinic, you want to partner with that doctor prior to the procedure. A lot of times it's done on the morning of the procedure, and understand a few things. Number one is it is going to be asymmetrical. It is not going to be a flat or a perfectly symmetrical hairline. That will look funny or weird. And this is very important because there's so much going on prior to your procedure. It is completely normal to have anxiety and butterflies. And then you get back home, or if you travel into your hotel room, you got a little swelling and you're like freaking out because one side's higher than the other. Well, I hope that this video gets out to a lot of you to understand that the top doctors in the world are not just good hair transplant surgeons, they're really good artists. They know how to do temporal peaks. They know how to do facial hair. They know how to make everything blend and look as close as possible to it never being transplanted. So when you request, it's not your fault. Hey, I want, doc, the most aggressive hairline you got. What do you got for me today? And is it flat? And is it really thick? And is it really symmetrical? No, no, no. Those are all no-nos. So you need to go into it maybe with the question, doc, it's going to be asymmetrical, right? Because if he says no, then I don't know if that's the right doctor in the right clinic.
Yes, if your hairline is perfectly symmetrical and even the way that it's drawn on you is perfectly symmetrical, you should probably walk out the door right then. So perfect symmetry is not going to look good on you. And actually, I will be very surprised if you get a hair transplant from a top surgeon and you go back home and you don't question your hairline and you don't look in the mirror and go, oh my gosh, I think he might have screwed it up. Because even me, after having had 4 or 5 hair transplants now, I think four that were like, yeah, actual hair transplants and one little just beard kind of thing. After having 4, the last time I personally had a hair transplant, and I know Dr. McGrath very well, I've seen many of his patients, like at least 100 of his patients in person. And still, I went back home and I was like, oh, I hope he did this okay, because it looked a little funny to me. It looked a little weird. And because it was like he had changed my hairline a little bit and it went down even less symmetrical than it was before. And, you know, that was strange to me. Seeing a different kind of hairline on myself was just a weird moment in the mirror. And so I had to just tell myself, okay, no, I know that this guy knows what he's doing. So he does this every day. He didn't screw up. I have to wait. I just have to wait. And so now it's grown in, and now I think it looks way better. I've looked at my before and after pictures, and it looks way better than it did before. And it's even less symmetrical. So this is something where you really have to trust the surgeon and just go, nope, I picked a great doctor. It's gonna be great. Because it takes the average person about 60 to 90 days with anything cosmetic on their body to just feel like, to sort of accept their new look, no matter whether it's better or not. So the third mistake that doctors can make, or that you could make, is avoiding 2 and 3 hair grafts in the hairline. So in the hairline, we really want to have mostly single hair grafts, maybe occasionally a 2 hair graft, depending on your ethnicity and what's normal for the rest of your head of hair. But generally, you want to have mostly 1 hair grafts. And if you have more than a couple of 2 hair grafts and you have 3 hair grafts in the hairline, it's not going to look natural. And you're probably fairly aware of that already. But that's something, that your surgeon should know, that if he's a top surgeon, we're using 1 hair grafts in the hairline.
David and I have talked about this a lot, and I'm very technical. I love it. I love to understand like technology and science and all that. And we've talked about this many times without using any doctors specifically. Of course, we never have a bad word to say about anybody. But the way that the hair transplants are done needs to be done under microscopes. It needs to be done with microscopic dissection. Now, an example, dark hair, light skin, dark hair, light skin, dark hair, light skin, I said it 3 times, is always a challenge aesthetically. It just is. You need to use on anyone's hairline 300 to 500 single-haired follicular units in order for that to look natural. They have different names for the blades, what the doctors use. There's different sizes. In the industry, and this is pretty much across the board, 89s, 90s, 91s, depending upon the size of the blade. So in the very front edge, when they're using, let's say, an 89, the only graft that can go inside that is a very small, very dissected, single-haired follicular unit, and that's how the tissue is placed. These are just questions you can ask your surgeon. There's a lot of ways to get around this if they're not using microscopes. It's really salesy, and it's going to jump out at you right away. No, we don't really use microscopes because of this reason. Or yeah, we use microscopes, but you go there in the morning and there's like 6 technicians and there's 1 microscope and it looks like it's got a lot of dust on it. That's a problem. So these are the things that I like to point out to all patients, just what to look out for, kind of like red flags. And the board certified doctors that we like to talk about on this channel, they're all using microscopes, and we're not going to talk about them.
Hopefully this helps you avoid the hairline mistakes. And if you watch some of the other videos on this channel, I'm sure you're going to have an incredible hairline and you're going to love it. We'll see you soon.